Have you ever woken up in the middle of the night, walked quietly to the bathroom, and thought to yourself, why is this happening again? Then morning comes, your legs feel heavy, your lower back feels tired, and even though you slept, you don't feel rested at all. Many people brush this off and say, it's just aging. But what if that explanation is dangerously incomplete? Here's the hard truth most people don't hear until it's too late. Kidney decline rarely announces itself with pain. It whispers slowly and quietly, night after night, and by the time it starts shouting, irreversible damage may already be underway. According to Dr. Richard Hale, one of the most common phrases kidney patients hear is, if only we had caught this earlier, not after a dramatic collapse, but after years of subtle warning signs that were easy to dismiss. Frequent nighttime urination, morning swelling, cold feet at night, persistent fatigue. These aren't just inconveniences of getting older. They can be early signals that your kidneys are under constant stress, especially after age 60, when blood flow naturally slows and low-grade inflammation quietly builds in the body. What makes this truly urgent is that millions of older adults in the United States are unknowingly accelerating kidney damage every single night without pain, without alarms, and without realizing what's happening. Most people believe kidney health is all about cutting protein, avoiding salt, or forcing down more water, but the real problem often runs deeper at the level of circulation inflammation and nighttime recovery. When your kidneys don't receive warm, steady blood flow while you sleep, they never truly rest, and night after night, that strain compounds. But here's why you should keep listening, because there is a way to support your kidneys naturally without extreme dieting, without harsh medications, and without chasing internet fads, and it begins with something almost every American kitchen already has. Used correctly at the right time, it can help restore circulation, calm inflammation, and allow your kidneys to finally recover while you sleep. And that's exactly what we're going to talk about today. Before we talk about how to use ginger, we need to understand why it matters, because without this part, everything that follows will feel like just another health tip instead of a real solution. After age 60, kidney problems don't usually start with failure. They start with circulation slowing down. Blood vessels stiffen, microcapillaries around the kidneys narrow, and overnight blood flow becomes uneven. Your kidneys don't shut down, but they never fully rest. That's why so many people feel okay during the day, but wake up tired, swollen, or running to the bathroom at night. I've seen this pattern again and again. People say my labs are only slightly elevated, or my doctor says it's normal for my age. But inside the body, something important is happening. When kidneys don't receive warm, steady blood flow at night, inflammation quietly builds inside the filtering tubes. Over time, this low-grade inflammation increases, creatinine disrupts fluid balance, and stresses the kidneys every single night without pain. This is where ginger becomes surprisingly relevant, not as a folk remedy, but as a physiological tool. Ginger contains active compounds like gingerol and shogal that gently improve peripheral circulation. They don't force blood vessels open. They help them relax naturally. Research shows these compounds support microvascular blood flow and reduce inflammatory signaling, particularly in tissues under chronic stress. In plain terms, ginger helps blood move more smoothly, helps tissues stay warm, and reduces the kind of silent inflammation that slowly damages kidneys. There's another layer most people miss. Ginger also interacts with the nervous system. It supports parasympathetic activity, the rest and repair mode your body needs at night. When that system is activated, blood pressure becomes more stable, nighttime spikes decrease, and kidneys aren't jolted awake by sudden pressure changes. This matters because studies show that nocturnal blood pressure instability is one of the strongest predictors of kidney decline in older adults. So ginger isn't working on just one problem. It's supporting circulation, calming inflammation, stabilizing nighttime blood flow, and helping the body shift into recovery mode, all prerequisites for kidney healing. But here's the critical part most people get wrong. Ginger only helps when it's used in the right way, at the right time, and for the right reason. And that's where the next part becomes essential, because one method supports recovery, while another can quietly make things worse. Once you understand that kidney stress begins at night with poor circulation and inflammation, the morning becomes your first chance to reset that damage. And this is where the first way to use ginger matters more than people realize. Not at night, not randomly. But in the quiet window, right after you wake up when your kidneys are transitioning out of their lowest blood flow state, many people start their mornings rushed, dehydrated, or with cold drinks. They don't notice it, but after hours of reduced circulation during sleep, this sudden shock keeps blood vessels tight and forces the kidneys to work harder than they should. I've heard countless people say, "I wake up feeling heavy, swollen, foggy." That's not age, that's circulation lagging behind recovery. A warm diluted ginger drink in the morning works differently from coffee or supplements. It doesn't stimulate, it awakens. Ginger gently warms the digestive tract, sends a signal through the vagus nerve, and encourages blood vessels, especially small peripheral ones, to relax. This helps blood return to the kidneys smoothly instead of in sudden surges. Studies on ginger's bioactive compounds show improved microcirculation and reduced inflammatory markers when used consistently, especially in older adults with vascular stiffness. What makes this method powerful is not strength, but timing. A thin slice of ginger in warm water, never hot, never concentrated, helps rehydrate the blood, slightly lowers viscosity, and reduces the pressure kidneys feel as they resume filtration. That's why many people notice less morning swelling and fewer bathroom trips later in the day after just a week of doing this correctly. But here's the mistake that cancels the benefit. Many people make it too strong, too hot, or combine it with acidic juices. That turns a recovery signal into a stress signal, especially for sensitive stomachs or unstable blood pressure. The goal is gentle circulation, not stimulation. If you're listening and thinking, "I've done ginger before and felt nothing," ask yourself this: did you use it to wake your kidneys, or did you use it like a stimulant? Because those are very different things. Used correctly this morning, ritual helps your kidneys start the day smoothly instead of defensively. But morning circulation is only half the story, because the biggest damage to kidneys doesn't happen during the day, it happens when the body cools down at night. And that brings us to the next method, which most people completely overlook, even though it may be the most powerful of all. If the morning ginger ritual helps your kidneys wake up smoothly, then what happens at night determines whether they ever truly recover. And this is where most people unknowingly lose the battle. As evening approaches, body temperature drops, blood vessels naturally constrict, and circulation shifts away from the extremities. For older adults, this shift is often exaggerated. Cold feet at night aren't just uncomfortable, they are a warning sign that blood flow is pulling away from the kidneys when they need stability the most. I once spoke with someone who said, "Every night my feet feel icy, and within an hour I'm up using the bathroom again." They thought the bladder was the problem. It wasn't. When the feet are cold, peripheral blood vessels tighten, resistance increases, and the kidneys are forced to regulate fluid under stress. This triggers nighttime urination, restless sleep, and morning fatigue night after night. A warm ginger foot soak before bed works through a powerful reflex pathway. The feet are rich in thermoreceptors and vascular nerve endings. When they're gently warmed, especially with ginger's active compounds, peripheral blood vessels relax. This lowers overall vascular resistance and allows blood to circulate more evenly instead of pooling or pulling back abruptly. Research in thermal therapy shows that warming the extremities can significantly improve nighttime circulation and reduce autonomic stress responses in older adults. Ginger enhances this effect. Its volatile oils interact with heat-sensitive receptors in the skin, creating a slow, deep warmth rather than a sharp temperature spike. This signals the parasympathetic nervous system, the body's rest mode, to take over. Blood pressure becomes more stable, kidney filtration calms, and the reflex that repeatedly wakes the bladder begins to quiet down. Many people notice fewer nighttime bathroom trips within days, not because their kidneys are filtering more, but because they're no longer being forced to overcompensate. The key is moderation. 3 to 5 thin slices of ginger in warm, not hot water, soaked for about 15 minutes. Longer is not better. Hotter is not better. The goal is steady warmth, not stimulation. When done correctly, the body cools down naturally afterward, which deepens sleep and protects kidney recovery. But here's what most people don't realize. Even if circulation improves, the kidneys can still struggle if the body has no alternative way to release excess waste. And that overlooked exit pathway is what we'll uncover next, because ignoring it can undo everything you've done so far. Even when circulation improves at night, many kidneys still struggle because they're being asked to do too much alone. And this is the part most people never think about. The body doesn't rely on the kidneys as its only exit for waste. It was designed with multiple pathways. But as we age, one of those pathways quietly shuts down, forcing the kidneys to carry the entire burden by themselves. That pathway is the skin. After 60 sweat glands become less responsive, temperature regulation weakens and the body releases far fewer water-soluble wastes through perspiration. You may not notice it, but when you rarely sweat, substances like urea, excess salts, and metabolic byproducts linger longer in the tissues. And when they don't leave through the skin, the kidneys must compensate, especially at night. I've heard people say I feel heavy at night, bloated, puffy, but I don't sweat anymore. That heaviness isn't just fluid, it's stagnation. When waste stays trapped in the interstitial spaces, the kidneys are forced into overdrive, increasing nighttime filtration stress and triggering frequent urination. This is where gentle ginger steam changes the equation. Unlike aggressive sauna heat, ginger steam works slowly and intelligently. Ginger's volatile compounds, when combined with warm vapor, stimulate heat-sensitive receptors in the skin. This causes peripheral blood vessels to open just enough to increase blood flow under the skin and activate sweat glands without shocking the cardiovascular system. Research on mild thermal therapy shows that light-controlled sweating helps redistribute fluid, reduce tissue congestion, and lower the load placed on the kidneys. Ginger amplifies this effect by improving microcirculation and calming inflammatory signaling at the skin vascular interface. The result is not heavy sweating, but effective sweating, just enough to offload waste that would otherwise burden the kidneys overnight. The timing matters. 10 minutes is sufficient. More is not better. The goal is warmth, a light sweat, then calm. After steaming, the body enters a parasympathetic state where muscles relax, circulation stabilizes, and kidney filtration becomes smoother instead of reactive. Many people notice lighter legs, less puffiness, and deeper sleep within days. But here's the crucial thing most people miss. Even if circulation improves and waste exits through the skin, the kidneys can still struggle if nighttime digestion remains heavy. And that brings us to the next step, because what you eat in the evening can either protect your kidneys or quietly undo everything you've just fixed. Even when circulation improves and waste can exit through the skin, the kidneys may still struggle if nighttime digestion keeps them under pressure. And this is where many well-meaning habits quietly backfire. After dinner, especially in older adults, blood flow naturally slows, metabolism drops, and the body prepares for rest. But when the evening meal is heavy, too much protein, oil, or salt, the kidneys are forced to stay alert for hours, processing nitrogen waste and excess fluids instead of recovering. I've heard people say I don't eat much at night, but I still feel restless, bloated, and wake up to urinate. Often it's not the amount, it's the metabolic load. Dense meals demand strong digestion, which pulls blood toward the gut and away from stable nighttime circulation. The kidneys are left juggling filtration and fluid balance in an already low-flow state. That's when nighttime urination, light sleep, and morning heaviness become routine. This is where a light ginger rice porridge in the evening changes the rhythm completely. Thin porridge reduces metabolic strain. It passes through the stomach, easily produces far fewer nitrogen byproducts, and requires less blood flow to digest. Ginger adds a crucial layer. Its warming compounds gently relax blood vessels around the lower back and abdomen, preventing cold-induced vasoconstriction that often triggers bladder reflexes at night. From a physiological standpoint, studies on low-residue evening meals show improved sleep quality, reduced nocturnal blood pressure fluctuations, and lower overnight renal workload. Ginger complements this by supporting microcirculation and calming low-grade inflammation in the digestive tract. Together, they shift the body into a parasympathetic state, the mode where repair happens. The timing is key. This is not a late-night snack. A small bowl eaten 1 to 1.5 hours before sleep, warm but not heavy. No fried foods. No salty sides. Just enough nourishment to prevent hunger without waking the kidneys back up. Many people notice fewer bathroom trips, warmer, lower abdomen, and deeper sleep within the first week. But here's what most people overlook. Even with better circulation, lighter digestion, and reduced waste load, the kidneys can still suffer if the lower back remains cold and tense. And that final missing piece, often ignored, may determine whether your kidneys truly recover overnight or continue to struggle. Even after improving circulation, digestion, and waste release, Many kidneys still struggle for one simple reason: the lower back never truly warms up. And this detail is far more important than most people realize. The kidneys sit deep in the lower back, surrounded by dense networks of blood vessels and nerves. When this area stays cold or tense, especially at night, blood flow to the kidneys becomes restricted, forcing them to work harder just to maintain balance. I've heard people describe this feeling perfectly without knowing what it means. My lower back feels stiff at night. I sleep with the air conditioner on, and my back feels cold by morning. I wake up tired even though I went to bed early. These aren't muscle complaints. They're circulation signals. Cold and tension in the lower back compress microvessels and trigger reflex vasoconstriction, reducing the steady blood supply kidneys need for overnight recovery. This is where gentle ginger oil massage becomes a turning point. Unlike deep tissue massage or heating pads, ginger oil works through both mechanical and biochemical pathways. When applied with slow circular motion, it increases local blood flow and relaxes surrounding muscles. Ginger's active compounds penetrate the skin and help counter cold-induced vascular tightening, allowing blood to circulate more freely around the kidneys. Physiologically, the kidneys receive nearly 20% of cardiac output. Even a small improvement in regional circulation can significantly reduce filtration stress. Studies on localized heat therapy show improved renal perfusion, reduced sympathetic nervous system activation, and better nighttime blood pressure stability. Ginger enhances these effects by calming inflammatory signaling and supporting microcirculation at the tissue level. The method is simple but must be done correctly. A small amount of diluted ginger oil, warmed gently, not hot, applied to the lower back for 10 to 15 minutes before bed. Pressure should be light, steady, never aggressive. Afterward, keep the area warm but breathable. Many people notice warmer legs, fewer nighttime awakenings, and less morning stiffness within days. But here's the mistake that ruins the benefit. Doing this irregularly or using excessive heat overstimulates the nervous system and cancels the calming effect. Consistency and moderation matter more than intensity. And now we reach the final, often misunderstood piece. Because even if circulation improves, digestion lightens, waste exits, and the back stays warm, there's still one habit that can quietly sabotage kidney recovery if done at the wrong time. And that last detail may be the difference between long-term stability and slow decline. By now you've heard how circulation, warmth, digestion, and waste release all work together to protect your kidneys. But there is one habit, small, common, and often misunderstood, that can quietly undo all of that progress if used at the wrong time. And it's something many people believe is healthy. I'm talking about ginger mixed with honey. Used correctly, this combination can be supportive. Used carelessly, especially late in the day, it can keep your kidneys and nervous system subtly overstimulated when they should be resting. I've heard people say, I drink ginger and honey every night because it's natural. But natural doesn't always mean appropriate for nighttime recovery. Ginger stimulates circulation and gently raises core warmth. Honey, even in small amounts, activates metabolic pathways and increases glucose signaling. When taken late at night, this combination can elevate alertness, increase heart rate variability, and trigger mild blood pressure shifts, exactly the opposite of what aging kidneys need after dark. Studies on nocturnal metabolism show that even small glucose and thermogenic inputs can disrupt parasympathetic dominance, leading to lighter sleep and increased nighttime urination. The key is timing and restraint. When ginger and honey are used sparingly, 2 to 3 times per week earlier in the day between meals, they support anti-inflammatory pathways and help reduce oxidative stress without activating nighttime arousal. Ginger's bioactive compounds assist circulation, while honey's polyphenols support liver detoxification, indirectly reducing the kidney's workload. This works only when the body is in a daytime processing state, not a nighttime recovery state. I once heard someone describe the difference perfectly. When I stopped drinking it at night and moved it to the afternoon, my sleep changed within days. That's not coincidence, it's physiology. This method is not about adding something new. It's about removing the wrong signal at the wrong time. No ginger drinks before bed. No just a little honey late at night. Respect the body's rhythm and the kidneys follow. And here's why this matters so much. Because kidney decline isn't driven by one big mistake. It's driven by small, repeated signals that tell the body to stay alert when it should be repairing. Fixing that signal may be the most powerful change of all. But understanding these 7 steps isn't the end. The real question is how to put them together into a routine that actually fits your life, because doing everything at once isn't the goal. And that's what we'll bring together next. If you've listened this far, I want you to know something important. Taking care of your kidneys does not mean living in fear, cutting out everything you enjoy, or constantly worrying about lab numbers. It means learning how to work with your body instead of against it, especially at this stage of life. Small, thoughtful changes done consistently often matter far more than drastic measures that are hard to sustain. You don't need to apply every single method we discussed. Choose 1 or 2 that feel realistic for you. Pay attention to how your body responds. Better sleep, fewer nighttime bathroom trips, warmer legs, lighter mornings. These are meaningful signals. They tell you your kidneys are under less stress and finally getting the support they need to recover. And if at any point you feel unsure or overwhelmed, remember this: you're not alone in trying to understand your health. That's exactly why this channel exists. If this video helped you, please take a moment to save it so you can come back to it later or share it with someone you care about. And consider subscribing to the channel because we regularly share clear, science-based medical insights designed specifically to help you protect your kidneys, improve sleep, and support long-term health without confusion or hype. Your kidneys have worked quietly for you for decades. They don't ask for much. Just warmth, steady circulation, restful sleep, and the right signals at the right time. When you give them that, they often respond in ways that feel almost surprising. There is always room to improve how your body feels, no matter your age. Stability is possible, comfort is possible, and with the right habits, so is hope. Thank you for spending this time with me, and I look forward to continuing this journey toward better kidney health together.